I thought I would start with your credentials because, it all starts with that. There's a lot of voices on this issue, so people are going to want to know your credentials. I noticed in just doing a little bit of research on you, and you've probably noticed too, that on your page as a doctor where patients are supposed to rate you, you've got people going on there now and criticizing you for speaking out about COVID. Like, what do you know? You shouldn't be commenting on this. You're a lone doctor in the Midwest and leave it up to the experts. So that's actually now showing up on your patient reviews, which has got to not be fun for you, but good for you for speaking your mind and coming to the forefront on this issue. So let's address people like that who say, what do you know?
All right. What do I know about anything in medicine? I have treated various conditions for over 40 years. And those conditions have been all the way from a strep throat to diabetes. And does that make me an ear, nose, and throat specialist? Does that make me a endocrinologist? Absolutely not. But I do have knowledge, and I do have the ability to understand scientific research and papers. And I can come to a conclusion after seeing and associating myself with those who are actually writing those papers.
So you've been a doctor for 40 years and specializing in what?
Family practice. I'm a board certified family practitioner. And that certainly doesn't disqualify me from taking care of a variety of illnesses, diseases, nor should it.
Right, but if they put you up against Dr. Fauci, who spent his entire career dealing with diseases, right, exclusively diseases, what do you say about that?
I say that I have listened to Dr. Fauci, and he has seemed to waffle back and forth on the subject of COVID. If we all remember correctly, he came out and first said, "Oh, you don't need mask." He's also, I have heard him on interviews saying that he actually thought that the dosage of the hydroxychloroquine would be much, much higher than that would be required in rheumatoid arthritis or lupus. And those are out and out statements that certainly have had controversy over his statements. And his statements now is you must wear a mask. And he said, well, that was because he felt that we would be low on protective equipment. Well, that is not a reason to not tell the truth to the American people. And when he says that you have actually a higher dose for COVID than you would rheumatoid arthritis or lupus, I would like to know where he's getting that data. Because, yeah. I mean, that is absolutely a farce.
Yeah, let me interrupt you there because I've made that point about Fauci, and I think it's really important to emphasize here that he acknowledged effectively that he lied about masks. He's saying that, yes, in fact, they are effective in preventing the transmission, but I said that they were not effective because I didn't want there to be a run on masks because we were concerned about hospitals having enough PPE. So he thought the ends justified the means, that it was okay to lie about that because there was a higher goal of protecting PPE. That tells you his MO, that he is willing, if he sees it in the public good, for him to lie about some treatment, some prophylactic, some vaccine, whatever it may be pertaining to COVID. He basically feels it's okay to lie if it ultimately serves what he sees as the good. So I think we should all look at anything that he says now through a special lens, now that he's admitted that. And you would probably say that, well, if he thinks a vaccine is the answer to everything, then that might cause him to intentionally diminish other types of therapies, such as hydroxychloroquine.
Well, there was also the excuse for not using hydroxychloroquine that there would not be enough doses for those who are already on hydroxychloroquine, which is those patients who have lupus or rheumatoid arthritis. And there again, that is still a farce because we have well over 60 million doses of hydroxychloroquine that are stockpiled by our government, not counting those who can manufacture the hydroxychloroquine and make that available to the American people.
Okay, so I don't want to get too much into that specifics now. I want to stay on credentials, because the other thing interesting about you as it pertains to COVID is that you were involved very early on in tracking this, I believe, based on other interviews, as early as December.
That is correct.
That you're part of some group that prepared a letter that went to Trump. Could you tell us about the group that you were part of?
I have a healthcare coalition call, and I've had this for several years now with physicians who are leaders of other medical organizations. And we have gotten together now for several years, and we discuss many topics in medicine. And of course, some topics that some people are not allowed to discuss, especially if they are hired by a hospital or an insurance company, because they can't speak out. They have to do what they're told. And so we have an opportunity to have a free discussion among ourselves on those calls. And within those calls, there are many subspecialties. There are subspecialties in those who have not only their medical degree, but they also have their degree in research. They also have their degree in chemistry, and some of them even statistics. And so when you put that all together, you've got quite an array of individuals who are very well versed in a wide variety of subjects.
And sorry, is there a name for this group?
It's just called the Healthcare Coalition.
Do they have a website?
No, and we do not want to have a website because that's the way that some of these people who are criticizing me certainly come and they fill your website with all of their comments when they have no idea what they're really talking about most of the time. Dr. Harvey Risch works with us. And I don't know, you're probably familiar with Dr. Harvey Risch. He's from Yale. He's done a great deal of research. There's Dr. George Fareed, and he's a Harvard graduate. We have many individuals. And by the way, Dr. Fauci is not basically someone that he is in the allergy department of the NIH. That's what he oversees. And he's a physician of basically allergy. And yes, he has a great deal of experience. But we have to realize that I don't do this just on my own. No, I'm not a researchist. No, I'm not even an epidemiologist. But neither is really Dr. Fauci. And yet he does have a lot of experience. He had experience certainly with MERS, with the Middle East syndrome. He had also with SARS-1. And at that time, he touted hydroxychloroquine as a wonderful antiviral. And he promoted that. And my question is, what has changed, Dr. Fauci?
So yeah, I want to get into that letter that you guys prepared, and then move on to talk about other things. So the group, this group, the Healthcare Coalition. By the way, how often do you guys meet approximately?
Every other week.
Okay, and presumably as soon as coronavirus hit the headlines, this was probably the primary focus of your meetings, I would imagine, back in December and January.
Actually, before it hit the headlines. There are some individuals who knew that this was going to be coming to our shores and coming very quickly. And so we began to research it. And when we researched it, we found the antivirals, like I said, that Dr. Fauci had used, which was hydroxychloroquine, as well as other medications. But we knew that it was a medication that would not kill the virus, but it would keep it from replicating. And so a group of us got together, chemist, PhD, also who is a researchist, as well as other physicians. And there was probably about 7 of us. And we even had Dr. Zelenko actually working with us as well on dosing of the hydroxychloroquine, because in this country, he was the one who had the most experience at that particular juncture. And so what we did was we found what hydroxychloroquine does. We explained that in a letter, and we explained that hydroxychloroquine could be a game changer for the American people, that we wouldn't have to shut down our economies. We wouldn't have to close our schools. We wouldn't have to quarantine and do all of these things that we certainly have done that has robbed us of community. And so therefore, we wrote the letter and we sent that to the president. And it was hand carried to him through someone who knew him very, very well. And he apparently read the letter, because the very next day is when he announced at the press conference about hydroxychloroquine could possibly be a game changer.
So let me just stop you there, because that is kind of just an intriguing part that people are going to want to know, is that there really was a connection between your letter and Trump's announcement. So how do you know when he got the letter? You guys, somebody reported to you guys that they'd actually handed it to him?
That is correct.
And who was that?
It was his late brother.
Oh, wow. Okay. So his late brother was connected to someone in your organization.
That is correct.
And he told you guys, hey, just so you know, I got the letter and I gave it to my brother.
That is correct.
And then the very next day, he's talking about hydroxychloroquine.
That is correct.
And ultimately, Trump says that he started taking hydroxychloroquine as a prophylactic, correct?
Yes, because he knew the science. He was told the science. He could figure that out himself, that this hydroxychloroquine. What my question is to those who are so opposed that I am giving erroneous information is this: how can a drug like hydroxychloroquine that has been around for 70 years, it is not approved for lupus, it's not approved for rheumatoid arthritis, or that is FDA approved, so to speak. It was approved by the FDA in 1955 for malaria, anti-malarial prophylaxis. But yet it is an antiviral, it's an anti-inflammatory. And in Spain, I have some Spanish doctors there that have actually told me that they have found that it has a little bit of an anticoagulation property to it also. Why is it that we are starting to use, even in breast cancer type of research, we're using hydroxychloroquine? Has it been approved for that? No. And the Lupus Foundation, who actually does prescribe 200 to 400 milligrams of hydroxychloroquine every single day for those patients, they don't require an ECG or an ECG or an EKG. They don't require that. They don't require any cardiac workup. And yet the dosages that we are giving is maybe 400 milligrams for 5 days. And then we are offsetting that with maybe one a week. We get down to one every other week. We get one down to one a month. Why? Because the half-life of hydroxychloroquine is 22.4 days. It begins to build up, and you don't need to take high doses. You're not going to see all this is nothing more. In fact, I have talked personally, and I do mean personally, with the cardiologist who is the QT World Health expert. And this individual told me they have no qualms about using hydroxychloroquine with azithromycin or doxycycline or hydroxychloroquine by itself.
And now, all this, correct me if I'm wrong, this is all about treating COVID very early on, as soon as you test positive and have some symptoms, to theoretically go on this, especially if you're high risk. What about as a prophylactic, as Trump was taking it? Did you guys address that in your letter?
We didn't at the time. No, we didn't. But we certainly have with other groups who have certainly met with the president and told that to him, because that's information that we actually have discovered as we have gone further into the illness of COVID.
Well, and correct me if I'm wrong, that's the primary, when we talk about malaria, that is the primary use of hydroxychloroquine, is as a prophylactic. Somebody's going to Africa in order to assure they don't get malaria. They take this as a prophylactic. Am I right about that?
You are correct. And we do that for our armed services. our all of our armed service individuals who go over to a malaria infested area, they all have the hydroxychloroquine. And that hydroxychloroquine, they don't administer a electrocardiogram for these every service individual who has this in their backpack, nor do they do a cardiac workup or an echocardiogram. In fact, we have now just, I think it was day before yesterday, I think it was September 13th, JAMA has just put out an article on the heart muscle and how COVID actually damages what we call the sarcomere within the cells of the heart muscle. And they have found, and this is also backed up with a study from, I believe it's Berkeley in California. They've also backed this up, that COVID actually is doing probably more damage to the heart muscle than it might be doing in the respiratory system. And it is breaking the small little filaments in that sarcomere that causes the heart to contract and then relax. And they are finding that this can sometimes show up maybe even months later, that that damage has been done to the myocardial muscle cells.
So in your view, it clearly makes sense that hydroxychloroquine, not just your view, and many experts' view, that hydroxychloroquine should work for COVID. But what about studies or research or just use? Has it been used widespread enough at this point to treat COVID that we've got some conclusions that can be drawn?
If those people who are criticizing will just look at the world map, they will easily find that answer, because the countries that have used the COVID and are now using it, such as China.
Who've used hydroxychloroquine?
Hydroxychloroquine,
Mm-hmm.
That is correct. They have used
where has it been used most prevalently?
It has been used in Italy. It has been used in Spain. It has been used in India. In fact, in India, very early on, I communicated directly with the Secretary of Health in India, not around the corner, but directly. And his take on this was this, that they are going to protect their citizens because they have been used to using hydroxychloroquine for malaria there for many, many years. And so they didn't have a fear of it being a cardiac issue or any other of the horrible side effects that they say. But nevertheless, he said to me, we are going to protect all of our first responders with hydroxychloroquine immediately. And then we're going to set up a protocol that if a family member does have COVID, then we're going to treat that individual with a different type of protocol. However, we are going to treat the entire family for prophylaxis. And he went on to say, we have 1.3 billion people in our country. We cannot afford to have millions coming into our healthcare system. It would overload us. We can't handle that. Nor do we have the privilege in India of having social distancing. He said there is not such a thing as social distancing in India. We are jam-packed in here. And so we have to do something to protect our populace. And so they started the hydroxychloroquine early. Jim, have you ever had the flu?
Yes.
Did you go to the doctor?
No, typically not.
Okay. Well, I'm sure that there's listeners here that have gone to the doctor with the flu. And one of the first questions that they will be asked by the doctor, or at least should be, is when did your symptoms first start? Why did they ask that? Because the Tamiflu is an antiviral that needs to be given within the first 5 days of coming into contact with the viral infection, the flu. And so after that, it is not near as effective because the virus has replicated to such a point that it's hard for the Tamiflu to catch up with the virus. And that's the same property with hydroxychloroquine. If people would not think, well, gosh, we have to do so much research. Yes, we have to do the research. We must do the research. But we also have to use with that common sense. And we have to say this is an antiviral, and it's not going to really be a whole lot different than when you go get Tamiflu.
And what are the results out of India? Do we know?
The results out of India are that they have found, they just did a study. In fact, I just barely got to look over it yesterday. But there is a study that does show that those who have taken the hydroxychloroquine of the first responders have an amazing, not only not getting COVID, but also if they should get COVID, a survival rate. Now, where a lot of these studies have gone wrong, and as you know, and I'm sure many of your listeners know, that many of the articles, such as the Brazilian study, the VA study, such as that out of Lancet, even in the New England Journal of Medicine, those studies have been shown as disproven. And one of the biggest reasons that they have been disproven, even Dr. Boulware up in Minnesota, his work was even showed to be faulty. Why? He didn't see patients. He did all of it over the phone. And they leave out the zinc. Now, why is the zinc important? Because the zinc is the hydroxychloroquine opens up the cell and it allows the zinc to come in to the cell if by some chance the hydroxychloroquine hasn't had a perfect coating around the cell to disallow the virus in. And when that zinc gets into the cell, it actually works its way into the replication of the virus. And it actually causes the RNA of the COVID virus not to reproduce. And therefore,
and this is all described in that letter that made it to Trump?
No, that's not all described in a letter like that. If the president doesn't have time to read a lot of that, but I'm sure he's been briefed on it, if nothing else, by his own physician at the White House. Because as President Trump said, his physician and he are the ones that decided if hydroxychloroquine would be used for prophylaxis and or treatment. And that's the way it should be for the American people. It should be between why should the president have that privilege and not the rest of the American people?
Let's talk about that as far as what the state of hydroxychloroquine is today in the U.S. I know that Cuomo had an order about hydroxychloroquine in New York that prohibited its use in many ways. I imagine that there's other governors that have done the same, but I also imagine there's lots of governors who have not done that. So I assume there's lots of states that you can take hydroxychloroquine for COVID, no?
There are not a lot of states. There are a lot of governors who have certainly prohibited it.
Right.
I'm in Missouri, right close to next door to us is Kansas, and their governor has come out and said that you can use hydroxychloroquine for anything but COVID.
Yeah, I mean, it's absolutely insane that governors are weighing in on something that should be between a doctor and a patient. I mean, it's just nothing but politics, and we can get into the politics of it in a little bit. But let's go back to, though, still, there's got to be lots of states where the governor hasn't made some proclamation about hydroxychloroquine. So what's going on in those states?
In those states, many times, the physician is being obstructed by the pharmaceutical boards, because the pharmaceutical boards have sided on against hydroxychloroquine. Now, why? Because hydroxychloroquine, to actually manufacture that one pill, it's 0.05 cents a pill to manufacture. Now, what are they going to be manufacturing remdesivir for? And by the way, remdesivir was actually tested in China and found to be by itself of no benefit whatsoever. And so the remdesivir is going to cost between $3,000 and $4,000 a vial. Now, tell me that there's not an incentive here to push the remdesivir or the vaccine.
Who makes remdesivir?
Gilead.
And
Gilead.
Is there a generic version?
There are versions, there are manufacturers who now have been trying to shut down their manufacturing of hydroxychloroquine and some other drugs to make a generic remdesivir. However, my question is this. Why are we counting on something like remdesivir when a patient gets that ill and it has to be hospitalized? Why are we overtaxing our hospital staff and our economy in order to?
Yeah, and what was remdesivir invented to treat?
It was back with Ebola. And
okay. So it has not been gone through studies for the treatment of COVID-19, just as hydroxychloroquine has not, right? Yet it's okay to prescribe remdesivir for COVID.
Dr. Fauci gave a study that he was promoting on remdesivir in the Oval Office at the White House. Obviously, the Oval Office is the White House. And so, nevertheless, what he did, he compared hospitalization days. He changed the study midstream because the remdesivir was actually, originally the study was set up to see if it made a difference in mortality. And so it was showing that certainly but what they did was they compared remdesivir, giving the patient the medication 5 days compared to 10 days. Jim, you don't compare the same drug according to the number of days. That is not a scientific study. A scientific study is if you have a placebo group to compare it to, or if you even have another drug to compare it to. So please don't criticize me for taking hydroxychloroquine, and I am taking it by myself, and for actually promoting it. Because that study that Dr. Fauci is touting is not a scientific-based study at all. And Dr. Raoult in France said he could not, in all good consciousness, not give the medication when he saw such a difference in the thousands that he was treating and turning their lives around. I've been doing telehealth. I see the difference in those within days that have turned around and don't need to go to the hospital. They don't need to be on ventilators. But, the hospital doesn't mind that in them coming, because if they get a pneumonia, a COVID pneumonia, or they're on a ventilator, they're getting from the federal government around $35,000 to $39,000 extra for that patient. Of course,
So going back to these states where the governor hasn't banned in some way hydroxychloroquine, so now it's up to the doctors to prescribe it, you're saying it's still really not happening because of all of the negativity that's swirling around regarding hydroxychloroquine, right?
Correct. And a lot of those who are working for hospitals, which is over 50% of our physicians who are in the field now, when they work for a particular hospital or an insurance group, they are told to follow the protocol that hydroxychloroquine will not be used. And what they're doing is, if you're very ill, many times, you go to the emergency room, they'll say, well, yes, you're COVID positive, but your fever might be low grade, 100, 99. Sure, you've got a sore throat. Sure, you have aches all over. Just go home and do the best you can. They're not offering them anything other than...
Well, one thing that all of our listeners can do, or perhaps should do, I'll ask your opinion on it, is ask their own physician, their personal family physician, and ask them, hey, would you consider prescribing this to me as a prophylactic because they're in a high-risk group, they're older or have some precondition? Or, gee, doc, I just want to know if I happen to get COVID, would you prescribe it for me?
Most physicians are being shamed into not doing it, not using it. I mean, personally, I have a case now before the Missouri Board of Healing Arts because I have used hydroxychloroquine on an individual who did well, but her ex-husband is an oncologist, and her ex-husband said that I was using a dangerous medication, that I have never been using hydroxychloroquine because it is too dangerous and it's not FDA approved for COVID.
Wow. Is this 1984 or what? I mean, this is just scary stuff. Now, you seem to posit that this is about big pharma making more money off of drugs other than hydroxychloroquine. Maybe, but to me, I see just politics all over this, that everything today in the media is either pro-Trump or anti-Trump. It's one or the other. And everything is seen through that lens. And when Trump comes out and touts this, the left would like nothing more than to make him look like a buffoon for suggesting that, oh, we've got some miracle cure, or not even a miracle cure, but something that can help. And they want to make him look bad. So they take the vet study and they misrepresent the veteran study, and the governors come out against it and so on. This is all politics, in my opinion. 99%. I'm surprised you're putting it as much on big pharma as you are. Maybe you can explain that. But for me, it's all politics.
Because many of our politicians have direct access or a financial invested interest in pharma.
Yeah, I know, but their hatred for Trump, and you got to remember, the media role in this is so huge, because it was the media that was all over this hydroxychloroquine and just criticizing and looking for any evidence to make Trump look bad for stating his support of it. I guarantee you, if Trump had instead at that press conference said, you know what, somebody brought to my attention hydroxychloroquine, but I would never take this. I don't trust it. I don't think that it's going to work for COVID. No one should take this. The exact opposite would have happened. And everybody would start taking hydroxychloroquine as a way to disprove Trump. So, I know, and I've listened to your other interviews where, you've made the point that, politicians are in the pockets of big pharma in many ways, but I just think the pro and I know you're right about that.
But pharma also spends a lot of money in media.
Yeah, but this is I'm talking about regular media, not paid media. This is regular media. And I don't know. It just seems to me it's so overwhelming. The anti-Trump fervor in this country of the people on the left is so overwhelming, especially at CNN and MSNBC and the major networks, that provides, in my opinion, the 100% explanation for this. This is an anti-Trump. He's supporting it. We're going to prove him wrong to make him look bad. That there is no easy solution for COVID. Your solution sucks, because you don't know what you're doing and you need to be out of office.
Let's look at Dr. Robert Kadlec a minute, who happens to be the Assistant Secretary for Preparedness and Response. He has direct ties to Emergent Biosolutions. And that company is the company that is actually making the vaccine for Oxford, for making it for Johnson & Johnson and AstraZeneca. All right. And Dr. Kadlec actually gave the biogenic solutions. He gave them $2 billion for smallpox vaccinations, for vaccine. He is the sole proprietor that actually oversees all the pharmaceutical material for our country. He also oversees the stockpiles that the government has put back of hydroxychloroquine. And does he not possibly have a financial interest in doing so with his old company by the Emergent Biosolutions, rather? And so we have to question, it overlaps. Yes, there's a political agenda here. We don't deny that. Absolutely. But also, there's a financial overlap in this as well. Also, power and position. Has the world really changed? It hasn't changed. Remember, sex, power, and money. Those are the three things that drive the whole entire world. It really hasn't changed that much.
Yeah. No, and I agree with all that. I think we're just slightly disagreeing about what was the major cause of it. But let's now talk about vaccine, because I do think one of the other kind of negativities toward hydroxychloroquine is, well, yeah, that means the person got sick. And now you found a treatment for somebody sick, but we don't want people to get sick at all. This is the situation that we've gotten into now, where it's no longer seems to be about deaths and number of deaths or overwhelming the hospitals. It's just about the number of cases that we freak out that there's a number of cases. Doesn't matter what their symptoms are. Doesn't matter if the person wound up in the hospital or not. We're just freaking out over the sheer number of cases has got people freaked out. And that's all the numbers that we hear about. So there's all this movement toward, we just need to stop people from getting this at all. And therefore, hydroxychloroquine, that just treats you once you're already sick. What good is that? We need to keep people from getting sick to begin with. Now, you could say that movement is about money, and I'm sure that plays a part of it too, but it's just part of the insanity that has just spiraled out of control when it comes to the way people are looking at COVID. And, Trump is right in there, potentially to blame on a lot of this for not speaking out more on it. But anyway, that's what I see when we see this push for a vaccine, that for some reason, Americans are buying into the idea that this thing needs to be totally eradicated.
Okay, we don't eradicate the flu, do we? We take our shots every flu season, everywhere you turn. When you go to the pharmacy, when you go to the grocery store, when you go to Sam's Club, when you go to Costco, there's a table there set up to get your flu shot.
And by the way, this is a burning question I have. Do you happen to know, roughly speaking, what percentage of Americans get the flu shot?
I don't.
Mm-hmm. The reason I ask is one of the points I've made about vaccines. Like, okay, you're going to come out with this, and what percentage of the population are even going to take it to begin with? And what percentage is it going to be effective for? Because we know vaccines are not 100% effective. Maybe they're more like, you could tell us, but more like 50% effective. So even if 20% of the people took it, which would probably be high, you're really talking about 10% of the people having now taken the vaccine. Having the positive antibodies as a result of this vaccine. So that's what we're sitting around waiting for, is for 10% of the population?
Well, the lead pharmaceutical manufacturer is Moderna at this particular juncture, that seems to be leading the way. And if we go back to that, and there again, you can say I'm a conspiracy theory. You can say that. You can say anything you want. However, when you look at the company Moderna, it's really strange that Ron Rosenstein had a great deal of stock in Moderna. And who is going to be giving our vaccine go ahead with a particular company? Well, it happens to be Nancy Rosenstein was her maiden name, and she heads up the CDC pharmaceutical. Whoever will be picked, Moderna is leading in that. Moderna has never made thus far a successful vaccine, never. However, and they use the messenger RNA, and that messenger RNA requires a lot of stabilizers, not a lot, but I shouldn't say a lot, requires stabilizers to stabilize that vaccine. And what's amazing is that the FDA does not have to know or even inquire what those stabilizers are. And we do know that those are being made from fetal aborted cells. We do know that. And right now, the flu vaccine, I was told, I haven't seen the article yet, but I was told this year is actually going to come from basically a cell line from dog kidneys. And so we have to realize that just because the FDA has let this go doesn't mean that they know even what's in the vaccines. And there's only one company that's making a DNA vaccine that's studying that, and that's Innova. And so, however, they are not at this particular time in the lead for putting out the vaccine. So we have to there once again ask, what is the motive? Jim, what is the motive? And if the American people don't have sense enough to ask that, then maybe they deserve to get what they're going to get, just like we did in the anthrax vaccine. Dr. Kadlik said that he personally gave our 800 of our armed service individuals the anthrax vaccine back in the day. And do you know that that vaccine now, after several years back, now it is directly related with the Gulf War syndrome. And so how do we know what we're giving today may not have repercussions tomorrow? How do we know that maybe if there is a political agenda here against President Trump, how do we know that they're not pushing the vaccine so that maybe a year or two later from now, we find that these vaccines had a repercussion? They're not going to blame pharma. Who are they going to blame? They're going to blame President Trump.
Is there a vaccine for malaria?
No.
Is there a vaccine for HIV?
Well, it certainly was tried, but no.
No. And there's no vaccine we know for the cold.
No.
So why is it that if after all these years, we've yet to get a vaccine for these major diseases, why is it that we think that we could get it for COVID?
Billions of dollars.
Well, but there's billions of dollars potentially for HIV, malaria, and the cold, right? And despite that,
already been spent. But we will be spending even more on this. There has to be, to me, this is nefarious. To me, this is something, I think that every American, like I said before, every American should have the right to try the hydroxychloroquine should they so desire. I do have a website up now that it's personalhealthcarenetwork.us to sign such a petition if any of your listeners certainly wish to, or if some of your listeners may have a loved one that has come down with COVID and is at high risk. I think, people say that President Trump certainly doesn't know what he's talking about when he talks about hydroxychloroquine or the COVID in general. However, I want to know how many governors know what they're talking about, these governors who have purposely put COVID patients in nursing homes. Do they know what they're talking about? Do they know what they're doing? I want to know. And who gave them the right to practice medicine? Who gave them the right to put those COVID positive patients in with the most vulnerable? I'll tell you what, a lot of those nursing homes are getting about $15,000 more money for those COVID patients in their nursing homes. Is that what we've done? Are we willing to sell our soul?
Considering that we haven't come up with the vaccine for malaria, HIV, the cold, and probably we could probably list a ton of other things, what do you think we should consider that it's likely that there will be a vaccine for COVID or that there won't be?
I can't tell you that. I really cannot tell you that. I can tell you this, that we haven't come up with a successful vaccine thus far, and these other illnesses that you have been so astutely able to point out. However, I do know this, that there are going to be billions of dollars that are going to be spent on a vaccine when we could do as Putin has done and as China has done and ramped up their production of hydroxychloroquine and zinc. And then as Putin did months ago, began to administer it out throughout every region in Russia to have it prophylactically. Yeah. And when you have to take a medication maybe once a week, once every other week, once a month, I don't see that being a burden.
Yeah. I think people need to get into the mindset that we don't need a vaccine to get through this. And the best example, I'm going to go back to those same things. It's like, are people freaked out in America about HIV? No, because we've got a very effective treatment for it now. Are they freaked out about the cold? No, because we've got treatment. Are they freaked out about malaria? No, we've got this prophylactic that you take. So people don't choose not to go to Africa because of the risk of malaria. They take these, as you point out, hydroxychloroquine to protect them against that, and they still go on their Africa trip. So people need to realize that we don't need vaccine to get through this, even though that appears to be the current mentality that has been sold to us. And it is unfortunate. I would like to hear your thoughts on Trump. It's unfortunate that it appears that he's gotten sucked into this thinking.
Yes, he has. And as we all know, or we should know, if we listen to the news at all, that when President Trump was first told about the COVID and the epidemiology portion of that and spreading, Dr. Fauci and Dr. Birx went into the Oval Office and said, President Trump, by the calculations coming out of the United Kingdom, we have noted the British studies that we will probably lose 2.2 million American lives with this COVID if we don't do something now. Now, you're the President of the United States. You're not a physician. You have got these experts who have come to you and told you that this is the data that they have gotten from intelligence in Britain. Now we know that that British study that they had done was now not correct. But yet at the time, that's what he was basing his information on. And he did what a prudent leader does. A prudent leader goes to an expert and they ask the experts. And that's what I know our group certainly has done. We have gone to the experts, not only in this country, but around the world to see what has been done. And we see a striking difference in the United Kingdom, Canada, and the United States in not only our death rates, but also in our economy and also in those who have COVID. We have seen an increase rather than a decline as drastically. Yes, we're seeing a decline now. I won't argue that, but we haven't seen near what other countries who have used the hydroxychloroquine have had in their population compared to us.
And what about the shutdown? Looking back, should we have shut down at all? And what should we be doing today?
Well, we looked at Sweden, of course. Sweden did not shut down. Sweden kept their schools open. They kept their economy going. They kept community alive, whereas we have shut down community. And
by the way, do you know what Sweden's policy has been on hydroxychloroquine?
They certainly have not opposed hydroxychloroquine as we have and come out against it. But I tell you this, they did not shut down.
Right.
And but yet we have.
Yeah, and I like something you said, because I tend to agree with this, that, hey, this thing is going to make its way through the population, and you can shut down for years and have it go very slowly, or you can live your lives, be cautious. If you're somebody who's older or has pre-existing conditions or whatever, be more cautious. But this is going to happen. It's either going to go quickly or it's going to go over years, right? Isn't that kind of your point?
You've heard this many times, Jim. I know you have, because you've had other people on this show. And you've heard it probably from even some of my podcasts. But never in the history of medicine have we quarantined well individuals. We quarantined, even back in biblical days, those who had leprosy. They didn't shut everybody else up. They took the leopards and they actually quarantined them. I mean, that goes back to thousands and thousands of years. And so logically, we could quarantine those who are at risk, or maybe those who have multiple comorbid conditions. But to actually shut down our country, to shut down our schools, to shut down community, my goodness, we've had a repercussion from that. I know you're a very intelligent man, and you have, I'm sure, read about the suicide rate being up, the child abuse rates being up, those who are depressed because they don't have interaction with other human beings. We are meant to be a society of community.
And there is risk to life. and we've always understood that there is risk to life, and we've been willing to take those risks. That's why we go 65 on the freeway instead of 20. But for some reason, this has all got turned on its head where we want to have absolutely no risk.
That is correct. And that's ludicrous. I mean, you mentioned the flu. We have flu vaccines. Have we eradicated the flu? Do we quarantine?
But we still live our lives.
We still live our lives. We still go to work.
What's stunning to me, you put it very well, but what's stunning to me is that we did it to begin with. So the fact that we did shut down, the 15 days to flatten the curve, that we did quarantine healthy people, as you point out, very unusual and first time ever. So it's pretty shocking that we did it to begin with. What's even more shocking is that here we are 6 months later and we're still doing it. And it seems like any pushback, the people that were pushing back during those 2 weeks and really upset about it, they've almost, it's dissipated. It's done. It's like the argument is over. We've lost. We are, local LA County health official, an unelected woman, Barbara Ferrer, if I got her name correctly. She comes out every day and she tells us what we're allowed to do and what we're not allowed to do. It's not even the mayor. It's not the governor. It's not the legislature. It's an unelected local health official who tells us every day what we're allowed to do that day. And people are okay with it.
And that's what's baffling to me, because that's not the American spirit that we have known. That's not the American spirit that brought this country to its greatest. And it is a lack of that type of spirit that will be our demise. And it will be that will actually cause our country to succumb to non-elected bureaucrats. And when did non-elected bureaucrats become such an authority? Where are they getting the social distancing? There's never been a study. A high school girl did do a paper at one point on some social distancing, or at that time it wasn't called social distancing, but distancing. And but as far as a double-blind study, has there really been a double-blind study of those standing in line to get closer together? I mean, is it 3 foot? Is it 6 foot? Is it 12 foot? Is it 20 feet? I mean, what is causing this? Who said that? Who said that mask will definitely protect you? I mean, we have schools that are required to have masks with teachers, the janitors, the students, but yet there are still outbreaks in our schools of COVID using masks. So, and masks were originally for those in surgery to protect from bacteria, to protect from, say the surgeon sneezes into the field. I mean, who knows what could happen?
I don't have much doubt personally that locking people away does slow the spread. I think that seems to be proven. But my point is, to what end are you locking people away? Because if there was a vaccine that we knew was going to be 100% effective and that 100% of the people were going to take it and is going to be available tomorrow, then maybe I'd be okay with okay, guys, let's batten down the hatches and wait for this thing. But we have no idea whether this vaccine is coming. We have no idea what percentage will take it. We have no idea how effective it will be. So the idea of thinking about a vaccine is totally wrong. We should be back at the original thinking was not overwhelming the hospitals. As long as we've got capacity at our hospitals and PPE and all of those things, then we need to go live our lives. Some people want to be more careful than others. Be more careful than others. Everybody make your own decision as to how careful you want to be, but we need to go out and live our lives. We have a healthcare system, the best in the world, ready to take care of you if you get sick.
Well, it's funny that you should bring that up, Jim, because a lot of our hospitals are going broke because they've been empty, because they have not been allowed to actually do a lot of what hospitals are supposed to do. They're not supposed to stand by and wait for a COVID victim to come in. They're supposed to take care of myocardial infarctions. They are to take care of surgical procedures, both elected and non-elected surgical procedures. They are to take care of our sick. But instead, many of them have been sitting with absolutely nothing to do, and they're going broke.
Yeah, do a lot of them still have policies in place that they will only treat essentially emergencies or really serious conditions?
That has pretty well gone away, I think, for the most part. But there still are those out there who will adhere to that recommendation. Why? Because they're afraid. Because I will tell you, hundreds, if not thousands of letters have gone out to physicians warning them that they should not be talking about any type of treatment for COVID that would veer away from touting the vaccine and touting drugs like remdesivir. That even goes, and I want your listeners to understand this. Dr. Fauci was asked at one point about the people of color possibly being more vulnerable to COVID. And what would he have to offer them? And what he offered them was actually social distancing, mask, and quarantine. All right, and that's fine. And I'm not an anti-mask or pro-mask. I could care less, whatever you want to do. But the point of it being is this, that he should know, that most all of our people of color are particularly vitamin D deficient. And we have found within our group that individuals who have a vitamin D level of 50 to 75 have not gone on ventilators. Now then, should we not at least be telling our population, get your vitamin D level up as winter is approaching. Get your vitamin C right. Get your vitamin A right, which actually helps protect your respiratory system. Take your zinc, and with that, take about 2 milligrams of copper. Because if you take a lot of the virus can deplete you of your zinc. And then take elderberry. For heaven's sakes, can't we at least do that?
And should people take zinc?
Yes, they should take zinc.
Because that you can get over the counter.
Well, yeah, you can get it over the counter. You can get elderberry over the counter. You can get vitamin C over the counter.
Right.
You can get vitamin D over the counter.
Right.
You can get copper over the counter. You can get all these things. You can get iodine.
Right. But you should, encourage, people out there such as myself who have parents that are older. They should be encouraging their parents to be taking these types of things, right? They
themselves should be taking it. If we build up our own immunity, we might have a better chance of actually fighting this virus in a much broader sense.
But last question, because we're running out of time, and just to wrap up on hydroxychloroquine, my parents are in their 80s. They're in good health, but they're in their 80s. Would you, if they had access to hydroxychloroquine as a prophylactic, would you recommend that they take it?
I probably would, yes, because they're
in a high risk. They're in a high risk group.
They're in a high risk group,
and you would have them take it. You would have them take it at least as long as coronavirus, this COVID is out there.
Probably so. Maybe one a month, eventually. Because it has like I said, a 22.4 day half-life. Mm-hmm. And there's no point in giving a lot of medication. I mean, you can only fill the glass so full before it overruns. Why overrun it? Fill it to, there again, go back to some just common sense. That's what we need to be using with science.
Thank you to Dr. Graves. She'd very much like you to sign her petition in support of the use of hydroxychloroquine. You can go to the Personal Healthcare Network website. That's personalhealthcarenetwork.org to sign the petition and or contribute to her organization. Thank you also to our producer, Michael Parker. Thank you to our intern, Jake Wall. We will be back with another episode of The Hidden Truth Show very soon.
Thank you for listening to The Hidden Truth Show with Jim Breslow. You can find us at hiddentruthshow.com. Follow us on Facebook, Twitter, and Instagram at Hidden Truth Show. Join us again next week for another episode of Hidden Truth Show with Jim Breslow.